Hello guys, welcome to my channel. Today, we are going to learn about scoliosis, but before that, please kindly click like and subscribe to my channel for more updated videos. Thank you so much. Now let's proceed to the topic. What is scoliosis? Scoliosis is three-dimensional spine deformity characterized by lateral and rotational curvature of the spine. It affects the spine in all three planes, axial, coronal, and sagittal. It may be functional or structural. Occur most often in girls. The most common form of scoliosis occurs in or near adolescence and termed idiopathic scoliosis. Idiopathic scoliosis can be caused by a number of conditions and may occur alone or in association with other diseases, particularly neuromuscular conditions. In most cases, however, there is no apparent cause, and thus the name idiopathic scoliosis. A family history of curvature of the spine is found in up to 30% of children with scoliosis, although no specific inheritance pattern has been documented. These are the classification according to age of onset. Infantile, at birth or up to 3 years of age. Juvenile, developed during childhood. Adolescent, occur during the growth spurt of early adolescence. Here are the assessment for scoliosis. Observation is performed behind an undressed standing child, noting asymmetry of shoulder height, scapular or flank shape, or hip height and alignment. Scoliometer is a commercial device that can be used to document the extent of spinal curve. MRIs, X-rays, and CT scans all play a role in estimating the extent of the deformity and in providing a baseline description. Risser scale is used to evaluate skeletal maturation. The radiographs. The scale assists in making a determination of the likely progression of the spinal angulature as the child's bones mature. Definitive diagnosis is made. Radiographs of the child in standing position and use of the Cobb technique, standard measurement of angle of curvature, which establishes the degree of curvature. Therapeutic management. 1. Bracing. One of the oldest form of corrections and still prime intervention. The Milwaukee brace was the first type used for this purpose, so, although today's braces look much different, they may still be referred to by this name. Wears for 23 hours per day, remove only for showering or participation in structure's athletic program. At night, a Charleston bending that confine the spine to an overcorrected position may be prescribed. Assess parents' knowledge on how to properly apply straps. Frequent follow-up visits. Mild analgesics such acetaminophen can be taken for muscle pain. 2. Halo traction. Halo traction is the use of opposing forces to straighten and reduce spinal curves that are severe when first diagnosed, over 80°, or that are progressing despite bracing. Halo traction is typically used for those children who have such severe scoliosis that they experience respiratory involvement or cervical instability or have a high thoracic deformity or decreased vital capacity from severe spinal curvature and rotation. Because it is so cumbersome, some children react to the apparatus physically, with nausea or diarrhea, or emotionally, with chronic sadness, until they realize they can adjust to it. Be certain that orientation is as thorough for the parents as it is for the child. Otherwise, parents may feel unsure and stress about the application. Halo traction is prescribed until optimal spinal correction is achieved. For the first 24 hours after application, most child experience a nagging level of pain at the pin. Children in halo traction need frequent care at the pin sites according to practitioner or hospital policy. After optimal spinal correction has been achieved, the equipment is easily removed. Preoperative care. Teach patient on how to manage his or her own patient-controlled analgesia, PCA, pump, how to log roll, the use and function of other equipment that will be used such as chest tube, Foley catheter, etc. The child is encouraged to bring a favorite toy or personal items such as favorite stuffed animal, laptop computer, or portable compact disc player for post-op use. Post-operative care. Monitoring of vital signs, neurologic status, wound and circulation. Log rolling when changing position to prevent damage to the fusion and instrumentation.